Welcome. Today I'm going to talk to you a little bit about the perfect face. We've done lots of research here in our clinic about the perfect face. And is there such a thing as a perfect face? Well, the reality is that yes, there can be a perfect face. For each individual person, it's possible to make the perfect face, mathematically speaking. Just mathematically speaking. And this is nothing new. Da Vinci knew about it. Pythagoras way before him knew about this. And this is based on the formula of phi, or the magic number phi, the golden ratio. Throughout nature, the golden ratio is preserved, and things that we find beautiful all follow this golden ratio of phi. And we can utilize this golden ratio to help identify and make the perfect face for each individual person. And we do that here to some extent. We understand these formulas. Michelle, who is my trusted injector along with myself, we both use a caliper on occasion to help identify what would be the perfect face for you, for each individual person. And we can look at it, we can measure how close it is to perfect, because no one's actually perfect, mathematically speaking, but we can get you closer to it by using fillers and neurotoxins to make the face look more attractive. And you will see how we do this. We have, if you look at the diagrams that we're presenting here today, you can see these faces with the formula, and you can see how we can determine what a perfect face would be prior to doing the treatment, then after the treatment. And you can see using mathematical formulas how close we get to getting the perfect face. So I'm going to go ahead and treat our patient here today with the calipers to show you how we go about to achieve the perfect face. So there's measurements that we look at on the face, and ideally the face gets broken up into thirds and into fifths. So we want the upper third of the face, which is the distance from the trichion to the nasion right there, to equal the distance from the subnasion to the nasion, and that distance should equal here. So she's pretty close to being symmetric in thirds. We also look at the fifths of the face. The face broke up into fifths. So we take the distance between the inner canthus, between the eyes. That should be the same size as the eye, and that should equal this distance also laterally, and here as well. This distance, the inner canthus, should also equal the width of the nose and the middle third of the lip. So that's how we determine the sizes of the lips, the nose, and the eyes. What we can also show you is that the width between the eyes should also equal the width of the brow to its peak, which is right there. And if we follow this golden ratio, which we want to use sometimes, we can determine where to put the fillers to make the face that much more attractive to the unknowing observer. Now, everything we do is about making patients look natural. No one should know you had this done. They should just look at you and think you look better. And following this golden ratio, we're able to make a face more attractive, but in a subtle way so no one can tell. We call it subliminal differences. And here's where we can, this is how we help to determine to create subliminal differences for you. So measure this distance, and then I know that this distance is 1. And using the golden ratio, because this caliper is created, so this distance is 1, this is 1.6. And it's based on the mathematical formula. So I know this distance is 1, then this distance is going to be 1.6, which goes to the distance of the lateral portion of the eye. I measure the inner canthal distance, and once again that should equal to the lateral portion of the eye. I can measure this distance of the eye, and this should also equal 1.6, which should be this distance to the temporal hairline. If I look at the same formula, the distance of the upper lip, 1 to 1.6, which is the golden ratio, should equal the distance from the lower lip to the chin. Even the lip itself follows the same ratio. The upper lip should be 1 to 1.6 for the lower lip. So you can see by using this formula, I can determine where she needs a little more filler to make her face closer to the perfect formula. So let's start right now, and we'll treat different areas of your face. I'm going to have a marking pen so I can mark some of these areas so people can recognize what we're talking about. So I'm going to look at her mid-pupillary line, and I know that that's a distance of 1. And from a mid-pupillary line, I can draw where her cheek highlight should be, which is right there. This should be on a line down from the lateral canthus, right there. So that's how I know where that should go on the cheek, and we can do the same thing on the opposite side too as well. So right about there, so I can now make sure that she gets the cheek highlights right in the place that she needs it. And then we're also going to treat her lips too, because she wants her lips a little bit bigger. So I'm going to look at this distance to to this distance. So I know her lower lip needs to be a little bit bigger to make it match the upper lip, because right now the upper lip's a little bit larger out of proportion to the lower lip. The other area I want to show you we're going to treat here is the temple region. If you see this area starting to hollow a little bit, so a little bit of filler in there will also make her look more youthful also. Alright, so Michelle, let's go ahead and get started. So we'll put some gloves on. So if you don't want to watch an injection, then I would suggest you turn off the video right now, but we're going to show you a little bit of the technique how we place injections. So we use something called a cannula, and a cannula is a blunt tip instrument that doesn't hurt much at all, and it's not a needle, it's not sharp, so it allows me to put product precisely where I want it. So a little poke right there, and then Michelle, why don't you go ahead and give me the needle? Thank you, the blunt tip cannula. And then I'm going to put this right into the port. And then I place just a little bit of filler right there, and I watch it as it goes in. Pressure there. Very nice. Okay, now we'll do the same thing on the other side. A little poke beneath.
That's how I feel, yeah.
And then I put the cannula in right underneath where I know she needs a cheek highlight based on my mathematical formula to make them the perfect face. Good, and that's it. See? Oh, that looks nice. So immediately her cheeks are elevated. And you can see that nice elevation of her cheeks. Look how nice that looks. Immediately her cheeks are elevated. Very nice. Okay. Now she has a little bit of a depression right under her lower eye right there. So we're going to go ahead and fill that in just a little bit too. So I'm going to give you this. Let's switch. Little poke. 1, 2, 3. Thank you. Okay. Good. You doing okay?
Good, yeah.
Good. Okay, that's it. So
I'm nervous that it's going to hurt, but it's not.
Does
Wow.
not?
Yeah.
Okay.
I mean,
Okay, look, open your eye. So you can see I filled in under her eye there too, and that cheek is done. Just like that. She got new cheeks.
I know.
That looks beautiful. And the hollows on your eyes filled in a little bit. This side doesn't need it as much. Fantastic. All right. So Michelle, let's do a little bit on the lips now. So that's filling in the cheeks, following the mathematical formula of the perfect face. A couple red dots, but those will be gone in a second. So let's measure, make sure we got it in the right place. She looks good. Size of the eye. Yeah, I'd say that's pretty good. Same thing here. Just to the eye. It's pretty good too. So her cheek highlight is in the perfect place to make her face look more youthful and more attractive. All right, let's go ahead and treat the lips. So this is a technique that Michelle and I here have developed for the lips. So I'm going to put a little poke right here. Good. Gently thread the cannula through. Just put a little bit in there. Good. And then we're going to put a little bit in the lower lip as well. Now this is a very benign technique for treating the lips. As you can see, she's not feeling much in the way of all of pain. It's a very gentle technique for the, okay, you okay? Maybe do a little bit lower lip on this side. It's not multiple injections. It's just one little porthole, and then I gently put the cannula through. Because it's not a needle, there's little to no bruising and swelling. Okay, good. Now let's go to the other side. Put a little bit more in there, please. So that's half her lip that's treated. Now we're going to do the other half. So it nicely inserts in the port. And it goes right into the lip. And I gently guide it with my fingers as it goes in the right plane, right to the Cupid's bow, which is right there. And just little gentle push as I place a little bit of product right in there. Good. And then we go into the lower lip. Little gentle push. That's it. Her lips are done. So this is very quick. Just a nice little treatment of her lips. Little to no pain and swelling. A little bit of swelling, but not bad. And she should be able to leave today feeling pretty good. And those lips are now much more proportion. All right, let's go ahead and treat her temples. Now, this is an area, the temple area, which I'm going to turn her head this way. It's not an area that's frequently treated by many people. We've been treating it now for years. We get fantastic results by filling in the temples. So we're going to go ahead and treat that temple area. Right?
With one, I'll fill it up.
Yeah. As we age, we start to lose volume in our temples, and people who are marathon runners or in really good shape tend to also hollow in their temples. But it's an area that we often overlook and don't realize that we're looking older than our age just by temples hollowing. So I'm going to put a little poke into the temple region. Okay, good. Feel this a little bit, Tina? You okay?
I'm fine. I can hear it.
Yeah, you can hear it, but it doesn't really hurt. So there's no anesthetic here at all. Now there's anesthetic in the product, so it's numbing as it goes in. So she's feeling a little bit of numbing, but it's not hurting, right?
No, just pressure like that.
Just a little bit of pressure. So everyone thinks this is such a painful procedure, but as you can see, it's generally speaking not very painful for most people as long as we're using these cannulas, and we have techniques here to reduce pain. Also, she has some topical placed beforehand. Her lips have a little bit of numbing in it prior to us treating it. But all these measures are taken so that it's a very comfortable experience, and all of this reduces swelling afterwards. Okay, that's treating that area of the temple. Let's take a look. Oh yeah, nice. You like that? Already it's coming in. I like it. You can't see it yet.
I know I can see it.
Okay. And then we're going to do this side. Does that hurt?
No, my ponytail was in the way. No.
You can take a look.
No, that's fine.
So you can see right away that that's starting to be filled in right there. And now we're going to do the same thing on this temple. So we'll turn her head a little bit. You can see her lips are in good proportion right now, and it's a little swollen. It'll go down. Her cheeks are in good proportion also. And now we're going to go ahead and fill this temple much the same way we did on that side. Little poke. Once again, we're using our cannulas, so we expect very little discomfort here. Okay, there we go. You okay?
Yeah.
So you're not feeling too much, huh?
No.
So she's not feeling too much as I move it around in the temple region. Fill in that hollow that we all tend to get as we get older. You okay?
Yeah.
Good.
There you go.
Okay, sometimes I have to move it around a little bit. Okay, that's it. And then I can kind of just mold it into place. All right, Tina, you're done. So she can go get makeup on right now. In fact, it would be a bad idea to even show that. She can go get makeup now without going to these ports, and she can go out, go shopping, do as she wishes. And you can see she had a filler treatment. She's closer to the perfect face with thanks to our calipers, which helps us to identify what is a more perfect face. Now, I want to make sure that it's clear that even if someone looks better, even if we get them closer to their perfect face, it doesn't necessarily mean they're happier. So happiness and perfect face are two separate issues, and I talk a lot about that in my book, Subliminally Exposed, because my goal is to make someone happier, not necessarily just make them more beautiful. And although we can make them more beautiful, it's important that it meets her expectations and her desires. And we'll give her a mirror and make sure she's happy with it and make sure it helps to meet her desires, because that's what we're really shooting for. Because it's my opinion that if we can make small changes in the corner of the mouth, the corner of the eye, not only do we make her face look more attractive, but we also make her feel better about herself. And that's what we're aiming for here, to make someone feel better about themselves. All right, Tina, you're all done. So we'll clean you off a little bit and we'll get you out of here.
With the cannula, I feel like there were less pokes, and I felt far less. I felt almost nothing. I had rhinoplasty when I was 14, and I've always felt like my nose is a bit crooked, and that makes me notice everything else that's not symmetrical. So with the caliper, I feel like it is more, the word I'm trying to use, precise as far as measuring where I need the fillers and how to make things on my face more symmetrical.